The sport of boxing and the field of medicine involving cadaver research naturally overlap considerably. The World Boxing Council, or the WBC, is boxing's most prestigious sanctioning body, and they share the responsibility of overseeing the rules and regulations of professional boxing. They value integrity, fairness, and perhaps most of all, the safety of athletes. In a sport where injuries are an intractable part of the game, the WBC are put in a tense and polarizing moral position to facilitate violence, but to do so responsibly, focusing on harm reduction. The cognitive dissonance that results from valuing health and safety on one hand while promoting boxing on the other makes them a convenient target for psychological exploitation. Some fighters recover from injuries, others, not so lucky. Understandably, many sensible consumers of boxing may feel pressured to invest more into medical research to counteract the brutality of such an injury prone sport. Cadavers provide a tremendously valuable means for medical research regarding injury treatment, and using compliance techniques, it wouldn't be impossible to push a few levers and get the WBC to donate their own. Our organization would wait for another professional boxer to get severely injured in a sanctioned bout involving the WBC, then we would capitalize on the backlash and use social media to label the WBC administration as being incompetent, morally apathetic, and afraid to engage with dissenters. The goal is to put pressure on the WBC until they agree to talk with us. Crucially, we must hire medical researchers at facilities taking in our donations to look into medical concerns of safety in boxing, and especially organ related injuries. We would introduce ourselves to the WBC administration as a nonprofit organization who funds medical research and that we have connections with specialized doctors and researchers who can provide valuable medical input on boxing policymaking to promote safety. We would encourage them to protect their fighters better and to prove that they are competent administrators and business people who are qualified for their jobs. At this point, the WBC may already likely be hypersusceptible to compliance, and so we would ask for a notably larger initial request to list out their top 50 safety concerns in boxing so that the researchers would know where to direct the study and would call back the next day for confirmation. The medical staff would then call and invite them to a presentation about a new discovery regarding boxing safety that supposedly correlated with their own self reported concerns. However, the presentation had no relation to their concerns and was actually a ploy intended to instill an important message that boxers were supposedly at major risk of organ failure from the impact of punches, often requiring a transplant, true though exaggerated. The medical research team would showcase graphic images of boxers getting transplants caused by their devastating injuries during competition, some of which were fights that the WBC themselves had sanctioned. Then, while still in a state of shock and confusion, our organization, along with the doctors, would remind the administration that injuries, even near fatal injuries, inevitably happen in combat sports, and to not blame themselves for poor oversight. Importantly, their primary focus should not be on injury prevention, but on better medical treatment after the fact, a physician's main area of expertise. Instead, while still recovering from the disorientation, we would ask the administration members to visit the injured patients themselves in multiple hospitals with our escort at their earliest possible convenience to show them sympathy and offer amends. During their visit at the last hospital, we would explain importantly that blood donations would inevitably help boxing patients get transplants since it was commonly used in their operations. We would say, quote, only a small vial of blood can save a life. Assuming that the majority donated, and more blood than just one vial, we would ask, do you feel good? They would likely proudly affirm yes. We would further tell them that no other WBC administration in history has ever gone this far to be so selfless and charitable, and that they are all true heroes. However, we would remind them that for transplants, blood is both less crucial and also more easily accessible than bodily organs, especially vital ones, which can only be obtained from a cadaver, and many patients die because there aren't enough. Our next increasingly large request is for the WBC to make a live public statement on the critical importance of donating their bodies to science. Finally, we would expect public protest against the WBC, accusing them of preaching something that they may not willingly do themselves and calling them hypocrites or liars. The situation plays straight into our favor, and we would reliably assume that the WBC administration would publicly respond by agreeing to donate their cadavers. The consistency and commitment principle speaks to the preference to perceive the self as being an intrapersonally consistent and steady, coherent whole without contradictions, and for this preference to be supported by a drive or commitment to maintain this steady self perception. The accumulating foot in the door technique via negative labeling is an enhanced compliance strategy in which an inconsequential action is performed and leads to a degrading response that is internalized, which increases motivation and compliance to restore self esteem. It accumulates when another increasingly large request is stacked on two previous smaller requests, with the larger and more recent of the two smaller requests increasing commitment to comply with this additional request, as the requests are consistent in some way. When a negative label decreases self-esteem, the motivation to get it back becomes activated as a defense mechanism that results in greater compliance as a means to reacquire the self-esteem that was lost. Labeling the WBC as incompetent implies unskilled, morally apathetic implies bad person, and afraid of engagement implies coward, all of which lower self-esteem and pushes our intended lever. Thus, they would accept my request for an in person meeting to show that they aren't afraid and to debate and disprove their perceived incompetence and apathy to restore their self esteem. As such, they would have fallen into the trap, allowing us to put our first foot in the door. Additionally, the WBC's lowered self esteem persists, raising their baseline levels of compliance prior to our meeting. During the meeting, when we argue, when we encourage them to protect their fighters better, we are effectively lecturing them on how to do their own jobs, while doubling down on previous accusations and implying that they are incapable due to either incompetence or indifference. With this subsequent reinforcement, self esteem continues to plummet while compliance skyrockets. With the consistency and commitment model in mind, by drawing their attention to their perceived incompetence and moral indifference, we are also putting WBC's code of ethics that they have upheld for years into greater scrutiny by the WBC themselves, who may ask, do we really practice what we preach? Quote, to protect the health and well being of boxers at any cost? This evokes their self concept, which believes that they're both competent and moral. Because their self concept is being threatened, commitment will consequently increase and make efforts to stay consistent with both one, their desire to truly uphold safety, which is morality, and two, to prove that they are competent businessmen, which is competence. Combining these effects of consistency and commitment with self esteem restoration exponentially increases compliance. Self blame and guilt from the foot in the door technique via negative labeling confounds with the desire for self verification from the consistency and commitment principle, which allow us to channel the merged motivation to act completely and morally, or to act competently and morally toward a productive task, namely contributing their top safety concerns for further research, which puts the second foot in the door. Compliance increases commitment via the self-perception theory, where intentions and commitments are informed and internalized through behavioral observation. The commitment and continues to grow each time we apply the foot in the door technique, prompting them to eagerly agree to attend the follow-up presentation, which was supposedly accredited by their own ideas. Again, commitment increases for the third time upon compliance. The fear the fear then relief procedure is a compliance tactic intended to elicit an acute sense of fear, resulting in an action program before fear is removed to cause a state of relief in which the abrupt withdrawal of intense fear halts the fear-inducing program, constituting a break between programs, resulting in a state of disorientation and confusion about what to do next. In this intermediate state, compliance is increased due to an inclination to act mindlessly before the normal action program or baseline state kicks in. As mentioned, the presentation was a ploy that set the stage for further manipulation. In response, in response to feeling self-blame and guilt, the WBC is now determined to see policy change to save face, to defend their moral dignity, and to protect fighters. But instead of being driven by guilt, they should be instead driven by empathy. Our previous tactics had wrongfully induced self-blame and guilt, neither of which were truly justified, since even the tightest and most well-formulated rules cannot fully prevent injuries, near-fatal injuries, or even fatal injuries in a sport whose primary objective is to incapacitate or hurt the opponent. The WBC knew this prior to our guilt-inducing tactics, which caused them to internalize fault, develop guilt, and see prevention as the only solution. Using the fear then relief procedure, we would show graphic images of organ transplants for we would show graphic images of organ transplants for boxers, abruptly close the images, then proceed to convince them not to feel responsible when they're in a state of heightened compliance. We also stress that focusing on boxing rules for injury prevention is less productive than improving medical treatments when injury is inevitable, which naturally aligns with their previous view, making change more feasible. Bolstered by the fear than relief procedure, our goal is to replace self blame with empathy motivated toward treatment, not prevention on WBC's part. While this process restores self esteem and decreases commitment driven by regaining a sense of competence, the vivid graphic images also function to enhance true empathy, causing a shift away from competence needs to acting toward fully toward acting consistently with internalized moral obligation, resulting in the same degree of commitment. Moreover, the WBC's awareness that they are overseeing and facilitating a violent sport fosters a firm sense of moral duty that ensures empathy will always be adhered to. While still disoriented, we use the foot in the door technique for the fourth time, again adding a larger request on top of the previous, and ask them to visit injured patients healing from transplantation surgery. With this act, we are leveraging their increased empathy to further strengthen the commitment to empathy via injury treatment means. The legitimization of paltry favors technique increases compliance by justifying the validity of trivial favors such that it feels unacceptable to give nothing and appeals to an altruistic desire by promoting a charitable image that one is internally pressured to fulfill. Usually, it produces a favor that is greater than trivial due to an altruistic drive. At the hospital, the legitimization of paltry favors technique is used after the last request of visiting the patients is entirely completed. The technique is paired again with an additional foot in the door request, the most demanding so far. We would request that the WBC donate their blood. Their commitment is now based on true altruism, also motivated by the emotional weight of the graphic images, which still haunt them. We capitalize on their increased empathy with a more substantial yet relevant request that is consistent with the same empathy influencing them to visit the hospital in the first place. To optimize the chances of compliance, we state that, quote, only a small vial of blood can save a life. Our rationalization technique not only makes a non donation scene unacceptable and results in higher than trivial donations, as would likely be the case just on its own, as it's also bolstered considerably by an accumulated commitment to medical altruism, which greatly multiplies chances of compliance. The foot in the mouth technique often involves a greeting that elicits a verbal admission that one is well off, which sets up a self applied expectation to comply to a request based on their positive state, that if rejected would cause awkwardness due to appearing stingy despite of one's well off circumstances. The foot in the door technique via positive labeling enhances commitment after compliance to initial request by expressing a positive characteristic associated with the act of compliance, causing the characteristic to be internalized and influencing behavior to reflect this newly enhanced self perception. After donating blood, the administration members would be asked if they felt good or if they were okay. They wouldn't likely mind the needle and would feel good that they had the opportunity to potentially save a life. We would affirm their satisfaction by labeling them as heroes. Thus, thus we combine the foot in the mouth technique with positive labeling, and instead of just giving them a basic affirmation, positive affirmation like "I'm glad," we attach a favorable trait in heroism. They would internalize the trait, and their actions would reflect it to help people in a selfless, brave manner. The characteristic of heroism also adds an emotional quality that strengthens the passion behind their purpose. Now, with a strong inclination to act heroically, we simply need to give them a direction to channel their motivation. Using our accumulating foot in the door technique, we request that the WBC make a live public statement promoting the cadaver donations, since organs are scarcer and more lives would be saved through transplantation surgery. Again, making the statement would activate the self perception theory, increasing commitment and enabling further compliance on larger future requests. Following the public statement, the WBC would internalize their role as loyal and devoted advocates of cadaver donations, driving further compliance to maintain this identity. But there would almost certainly be substantial public criticism and backlash, and we're counting on that. If people accuse the WBC for virtue signaling, being hypocrites, or for being downright disingenuous, it would offend their sense of self identity such that it provokes them to assert their values unapologetically and prove them wrong. The WBC would therefore be expected to comply with any request or prompt, certainly such as agreeing publicly to donate their own bodies to their proud cause. Now I'll pitch the strategy in real time as if I were speaking directly to the WBC. Mr. Suleiman, thank you for meeting with us. We are tremendously grateful for your time. As you know, we are a nonprofit organization like the WBC. Our job is to work with doctors to fund medical research that focuses on treating patients with severe injuries. Recently, the medical attention has shifted to combat sports following last week's terrible injury. We have doctors who want to work with you to protect fighters better from a medical perspective. You all know that you have a responsibility to protect your athletes. And in light of the recent backlash, we know that you're capable of restoring your public reputation. For our medical team, we ask that you list out the top 50 safety concerns in boxing for further research. Our team will be in touch with you tomorrow. This is the brutal reality of medical treatment and organ transplantation. Yet, as you are all aware, boxing is the hurt business, and pain is the name of the game. Even the most proficient safety regulations that you can impose can't alter the violent nature of the game, and violent games produce violent consequences. Instead, it's advantageous to shift your focus from injury prevention to medical treatment post injury. The best you can do is empathize with these brave warriors who risk their lives for our entertainment. We would encourage you to visit a few of these boxing patients in the hospital who are currently recovering from the surgery to show them your support as soon as convenient. There are many boxing patients in need of surgery who require blood donations. Would you be willing to donate your blood? Remember, only a small vial of blood can save a life. Do you feel good? That's great to hear. No administration has ever committed to such selfless acts of charity. You are true heroes. But I must say that blood donations are trivial compared to organ donations. Cadaver donations save millions of lives, including boxers, every year. It would do injured boxers and hospital patients a tremendous justice if you were to make a live statement on the importance of cadaver donations to the boxing public. And finally, some notes.